On this Medical Monday, we've got Dr. Kay Chandler here with Cornerstone Clinic for Women to talk about how the FDA is ordering manufacturers to stop selling surgical mesh for women's prolapse surgeries. Good morning, Dr. Chandler. You may have seen commercials. I know I have on TV. First, what is the purpose of using surgical mesh?
Well, many women start having relaxation of the vaginal wall from lots of reasons, but childbirth or just as they age. And so they have prolapse. So the bladder drops, the rectum kind of pushes in. It's like a hernia there.
Okay.
And it causes a lot of symptoms. They may have incontinence, they may have pressure, they may have discomfort, pain. And so there's been some thought, and some evidence that the mesh may be a better way to hold it up longer, because these surgeries that we've done in the past using our own tissue, a lot of times they fail. And so they're trying to find something that would not fail as quickly or that have better results. And so therefore we use mesh. But then with that comes sometimes its own set of problems.
Right, and clearly because the FDA is ordering them to stop selling them.
Right, and so, but I want to make a couple things clear. This was a certain type of mesh that are talking about, not all surgical mesh.
Good to know.
Yeah, so there's a mid-urethral slings this does not affect those.
Okay.
And there's just a small little tape of when people have incontinence, and then there's a procedure called a sacral colpopexy, which is more of a laparoscopic procedure that they use to kind of pull that up, for women. So the sacral colpopexy and the mid-urethral slings are not what we're talking about here. We're just talking about a couple of the mesh procedures that would go for the anterior vaginal.
So for these specific ones, what was the issue? What was the concern?
Well, there have been, millions of women have had these procedures, and there have been some, reports of complications or problems post-op or, long-term. And so, the FDA was looking at this, and they asked for some information that this is actually safer and that it's better than de novo tissue. Well, they feel like the companies could prove that, but they did start a post-surveillance study that was supposed to be 3 years. Well, like anything, there's always two sides to the issue.
Right.
The FDA has pulled it after a year, whereas some of these organizations, American Association of Laparoscopic Gynecologists, American Association of Urogynecologists, are like, wait a minute, why start the study if you're not going to finish it?
Right, very true.
So there's some concerns about that there.
So if you have this already or were thinking about getting it, what should you do at this point?
So good question. So if you have
it's like you gave them to me. No.
Oh yeah. If you have it, and you're not having any problems, then don't worry, because many women, it's really maybe the low is 5%, maybe some studies say 10, or some of the issues say 10 to 15% of women have had complications. So the majority of women don't have problems with this. So if you haven't had problems, don't worry.
Don't worry about it.
You have to get this out. Still go to your annual examination to be checked, but you don't have to get it out. If you're needing a procedure like this, one of the things I do when I see a patient who has this, yes, I did these the de novo surgeries with their own tissue when I was in residency, but if you don't do a lot of these procedures, you may not be an expert in this procedure. So I talk about other options, physical therapy, pessaries, and then if I think they need surgery, I'm going to send them to a urogynecologist. I have the fortune of having one in my office, Dr. Brennan, shout out to him. But there are some urogynecologists and surgeons who are very versed in have expertise in this procedure.
All right, always good to know. Thank you so much, Dr. Chandler. Great explanation there.